A massive 17-year study just dropped some shocking news about American kids. Their health is getting worse. Not just in one or two areas, but across nearly every single measure researchers could find. We're talking physical health, mental well-being, survival rates. The whole picture looks grim. And here's the kicker. America's children are now far more likely to die than kids in other wealthy countries. This isn't some small survey either. Researchers analyzed 170 different health indicators from 8 major data sources, tracking kids from 2007 to 2023. What they found was, in the words of lead researcher Dr. Christopher Forrest, a generalized decline in kids' health. When the guy running the study says the surprising part wasn't any single statistic, but that all 170 indicators showed the same downward trend, you know we've got a serious problem. Let's start with chronic conditions. Back in 2011, about 40% of kids had some kind of chronic health issue. Fast forward to 2023, and that number jumped to nearly 46%. Think about that. Almost half of all American children between ages 3 and 17 are dealing with ongoing health problems. We're not talking about catching a cold here and there. These are conditions like anxiety, depression, sleep disorders, asthma, ADHD, and early-onset diabetes. The obesity numbers paint an equally troubling picture. In 2007-2008, about 17% of kids were obese. By 2021-2023, that climbed to 21%, 1 in 5 kids. And with obesity comes a whole host of other health problems that can follow these children into adulthood. But here's where it gets really concerning: the mental health crisis among young people. Nearly 1 in 5 children, ages 3 to 17, has been diagnosed with a mental, emotional, or behavioral health condition. Depression and anxiety rates have skyrocketed, with 11% of kids now diagnosed with anxiety and 4% with depression. Among teenagers, the numbers are even worse. More than half report feeling persistently sad or hopeless, and suicide has become the third leading cause of death for those aged 15 to 29. Dr. Forrest, who's been a pediatrician for 25 years, put it this way. When he started his career, chronic conditions in children were uncommon. Now, they just seem to be sicker, and it turns out they are. But the most heartbreaking statistic of all, American children are 1.8 times more likely to die than children in other high-income countries. Let that sink in. Your child is almost twice as likely to die growing up in America compared to growing up in Canada, Germany, or Japan. And the biggest driver of this mortality gap? Gun violence. American kids face a 15 times higher risk of dying from firearms compared to their peers in similar nations. Firearms have become the leading cause of death for American children and teens, surpassing car accidents, cancer, and every other cause. Every single day, about 60 children and teens are shot in America. That's not a typo. 60 kids every day. The statistics are staggering. In 2021, there were 4,739 child and teen gun deaths, the highest annual number ever recorded. That's 13 children dying from gun violence every single day. The U.S. accounts for 97% of all gun-related child deaths among comparable nations, despite having only 46% of the total population of those countries combined. Black children bear an especially heavy burden. They're 18 times more likely than white children to die from gun homicide. For many kids today, the threat of gun violence has become a normal part of growing up. School shooting drills are now as common as fire drills, with 95% of American schools conducting lockdown procedures. From 1999 to 2004, about 19 per 100,000 school-aged children were exposed to a school shooting. By 2020 to 2024, that number had nearly tripled to 51 per 100,000. The pandemic certainly didn't help matters. Mental health emergency department visits for kids ages 5 to 11 increased by 24%, and for adolescents aged 12 to 17, they jumped 31%. But experts are clear this isn't just a COVID bump. These trends were already heading in the wrong direction before the pandemic hit. COVID just poured gasoline on an already burning fire. What makes this even more frustrating is that we're not talking about rare diseases or conditions we don't understand. Obesity, mental health issues, gun violence. We know what causes these problems, and we have evidence-based solutions. Yet the numbers keep getting worse. The research also revealed massive disparities based on geography and income. Kids in poverty face significantly higher rates of chronic conditions and are more likely to have multiple health problems at once. Those on public insurance have systematically greater prevalence, complexity, and severity of health problems compared to privately insured children. Where you live matters too. Some states have child gun death rates more than 10 times higher than others. Early menstruation has increased from about 9% to nearly 15% over the study period, which researchers link to rising obesity rates and exposure to environmental factors. Sleep problems are through the roof. Physical activity levels have plummeted. It's like watching a slow-motion health disaster unfold across an entire generation. But why should this matter to you? Because these aren't just statistics. They represent millions of children whose potential is being limited before they even reach adulthood. Kids with chronic health conditions miss more school, have trouble concentrating, and often struggle socially. Mental health issues in childhood frequently persist into adulthood, affecting everything from career prospects to relationships. And obviously, kids who don't survive to adulthood never get the chance to reach their potential at all. The economic costs are staggering, too. We're spending about 90% of our $4.1 trillion annual healthcare budget on chronic diseases. A single gun homicide costs taxpayers $2.1 million. Columbus, Ohio alone spends $500 million a year dealing with gun violence. These are resources that could be going towards education, infrastructure, or preventing these problems in the first place. Health Secretary Robert F. Kennedy has emphasized improving children's health as a priority, though pediatric experts worry that some administration actions might undermine these efforts. What's clear is that no single solution will fix this. We need comprehensive approaches that address root causes: poverty, access to health care, gun safety laws, mental health support in schools, and creating environments where healthy choices are the easy choices. The good news? Some recent data shows slight improvements in certain areas. Teen mental health showed some positive signs in 2023, with decreases in persistent sadness among some groups. Gun deaths, while still unacceptably high, decreased by about 12% in 2024 compared to 2023. These glimmers of hope prove that progress is possible when we take action. Dr. Forrest summed it up perfectly. Every country, regardless of its circumstances, can do something to significantly improve the health of its children. The question is whether we have the will to do it. What do you think needs to happen to reverse these trends? The health of an entire generation hangs in the balance, and the clock is ticking. Like and subscribe if you enjoyed the video.